Now, hospitals in COVID hotspot areas are taking serious strain. Many public and private hospitals in the Eastern Cape and along the Garden Route are full. Medical group Discovery, we spoke to them a little earlier, has urged members aged 60 and above and those with serious health problems not to visit COVID-19 hotspots during the holidays. They've had to airlift patients out of these areas as the hospitals are simply too full to treat them. With both private and government hospitals under pressure, there are fears you will simply not get treatment when you really need it. Now, Netcare is the leading private healthcare provider in South Africa. I'm joined now by the CEO of the group, Dr. Richard Friedland. Good evening, Dr. Friedland. Thank you very much for your time. Could you start by telling us which areas, in terms of your hospitals, are of greatest concern at the moment?
Well, unfortunately, we are seeing a surge in 4 provinces. As you've mentioned now, the Eastern Cape, where we have about 170 patients in total. But also we're seeing a very significant rise in KwaZulu-Natal, also in the Western Cape, and it's now beginning in the Gauteng. So we're fighting this virus on 4 fronts at the moment, very different to the first surge, which was limited to the Western Cape, then moved to the Eastern Cape, then the Gauteng, and lastly to KwaZulu-Natal. So a very serious situation indeed.
We spoke to Dr. Ryan Noach of Discovery a little earlier, and he said that they're actually having to organise that patients in sort of the small holiday towns, some of them have had to be airlifted out.
Correct. We've airlifted 2 patients out of Plettenberg Bay to Cape Town, to our hospitals in Cape Town, and we're extremely concerned. We've seen far more severe cases in the second wave, people requiring more oxygenation, and we've had higher mortality in the Eastern Cape. We're not absolutely certain as to why that is the case, and we are collaborating with the NICD and CRISP at the University of KZN and the gene sequencing platform in South Africa to understand what is actually happening at the moment. But this is a clarion call to all South Africans to take this extremely seriously. Certainly the numbers in the Western Cape appear to be higher, and certainly in KwaZulu-Natal look like they're going to exceed the first wave.
Yeah, it's interesting because what we understand is that mid-January could be the peak of our second wave, roughly, and I'd be interested to know if you share that view. But that KwaZulu-Natal is a little behind the Eastern and the Western Cape, but is going to catch up soon. Is that right?
Well, actually, we've got more cases in KwaZulu-Natal as we speak. We've got well over 1,000 cases in our hospitals that are positive, and we have over 800 cases currently undergoing investigation, and that's very significant. But by far, the majority of cases are in KwaZulu-Natal, and that is doubling much quicker than the other 2 provinces. So it's taken over the Eastern Cape already. The Eastern Cape is kind of plateaued. That's what our numbers are showing, and the Western Cape is rising almost as fast as KwaZulu-Natal at this stage. Gauteng is just beginning to take off, and we're very concerned when holidaymakers return from the coast to the Gauteng that they may well bring the virus with them if they're not vigilant.
When do you expect the peak of the virus in the various provinces?
Well, I think we are seeing that plateau already in the Eastern Cape. We've kind of seen that peak as we stand. We haven't yet seen it in KwaZulu-Natal, but certainly in the next 2 to 3 weeks, and certainly in the next 2 to 3 weeks in the Western Cape. We do think it's going to be delayed in the Gauteng, but it is certainly on the rise at the moment.
And as you say, this is different to the first wave. It seems to have come on much quicker, and you're fighting it on 4 fronts. And this is in the private hospital sector, which is better resourced than government hospitals. Just explain to us the sort of joint effort and how Netcare is actually working with government as well, because I'm sure it's all hands on deck at this point.
Well, of course, on the ground, we're all healthcare workers, and our healthcare workers on the ground are working hand in hand together with emergency services from all departments, public and private. And, you know, we want to assist wherever we can. We have a very close working relationship with the Western Cape Department of Health. We've signed an agreement with them to accept their patients. And we stand ready to support other provinces in this fight against the virus.
How are staff doing? It's been a rough year.
Absolutely, Sally. Staff are exhausted. I want to salute our frontline workers. They have made an enormous contribution, both in the public and the private sector, to South Africa and to keeping South Africans safe. But 8 months into this pandemic, staff are exhausted. They have to live with the day-to-day anxiety that they might possibly get the virus. And obviously, uppermost in our minds is keeping our staff safe. For many of our staff, travelling to work is a hazard. Many of them live in difficult socioeconomic circumstances where social distancing is difficult. And so we're seeing a lot of spread of the virus still within our communities. And obviously that impacts our workers, who in turn become infected.
Would you endorse what the President said on Monday night, that if you don't have to go on holiday, rather stay at home?
Absolutely. And I have to say this, we fully endorse what our President was saying this week. And we feel he could have even gone further, because I think that we are about to experience a wave that is far more significant than the first wave we experienced. And we're very, very concerned about capacity, both in the public and private sector, as this progresses.
Well, thank you for being so frank with us and updating us on what is happening in the private health sector as well. We already know how difficult it is in government hospitals, but the private sector is taking strain, and it looks like it's more intense than the first wave. Thank you very much, Dr. Richard Friedland, CEO of the private healthcare group, Netcare.